we've got to get started now because we're straight up 11 o'clock. Dr. Jensen, do you want to get started?
All right, sure, yeah. Well, everyone, welcome to Grand Rounds. Thank you for coming and participating in this lecture. Today's guest lecturer is Dr. Pumariega, and Dr. Mosier is going to actually do his introduction. But first off, we've got some housekeeping things that I'd like to make sure that everybody's on the same page for. So make sure that you mute yourselves during the presentation so that we don't get any feedback. The chat feature, we can use that to collect questions throughout the presentation. So if there's a question that you would like to ask our guest speaker today, then just go ahead and put that in the chat, and we'll have a running list of all the questions to then ask at the end of the lecture during the question and answer time. I think that's all of our housekeeping things for now, and so I'll turn it over to Dr. Mosier for the introduction of our speaker. Thank you.
Thank you, Dr. Jensen. The ETSU Department of Psychiatry and Behavioral Sciences annual Dr. Hubert R. Booney Vance Memorial Lecture was established in 2004 in memory of Dr. Vance, who was a world-renowned scholar, leader, and speaker who left a legacy of innovative approaches for the treatment of children with learning disabilities and adults with dementia. I have the distinct honor and privilege to introduce this year's Booney Vance Memorial Lecture presenter and my mentor and friend, Dr. Andres Pumariega, who is a friend and colleague of Dr. Vance's. We were looking forward to hosting Dr. Pumariega for the Vance Memorial Lecture last May in person, but we had to cancel the in-person presentation, and Dr. Pumariega was kind enough to agree to come to us via Zoom today. We look forward to learning more about the tenets of cultural competence through the examples from Dr. Vance's life and work today with Dr. Pumariega's talk, Cultural Competence in Mental Health, Lessons from Booney Vance. Dr. Pumariega has devoted his over 40-year career in psychiatry and child-adolescent psychiatry to children's system of care and cultural diversity in mental health. He is currently professor and chief in the Division of Child and Adolescent Psychiatry, Department of Psychiatry, University of Florida College of Medicine, and the University of Florida Health. He earned his MD from the University of Miami School of Medicine and later was inducted into its Alumni Hall of Fame. He completed his residency and fellowship in general and child psychiatry at Duke University Medical Center. Dr. Pumariega has had a long, productive, and creative career. He previously headed 2 pediatric psychiatry consultation liaison services, 3 directorships of child and adolescent psychiatry, and chaired 3 departments of psychiatry. Near and dear to me, he was one of the Tennessee state leaders who developed the concept of the Centers of Excellence for Children in State Custody and was the first director of the COE here at ETSU. I had some very large shoes to fill starting in 2006 when Dr. Pumariega left ETSU for other challenges. Dr. Pumariega also served as the co-principal investigator for the New Jersey Pediatric Psychiatry Collaborative and is the current principal investigator for the North Central Florida Pediatric Collaborative Program. Dr. Pumariega is a distinguished life fellow of the American Psychiatric Association and the Academy of Child and Adolescent Psychiatry, and a fellow of the American College of Psychiatrists and a fellow of the American Ortho Psychiatric Association. He has served as associate editor of Adolescent Psychiatry, American Journal of Ortho Psychiatry, and the Journal of Child and Family Studies, and is on the editorial board of Community Mental Health Journal. Dr. Pumariega was a co-leader for the drafting of the CMHS Cultural Competence Standards, the AACAP practice parameters for both the community system of care and culturally competent child and adolescent psychiatric care. He served as president of the American Ortho Psychiatric Association and the American Association of Social Psychiatry. He was also the founding chair of the work group on system of care and co-chair of the AACAP Committee on Diversity and Culture for 8 years. He was the chair of the APA Committee on Hispanic Psychiatrists. Dr. Pumariega has over 200 scientific publications and has published over 250 abstracts, edited 3 textbooks, and 4 journal special issues. Dr. Pumariega has received numerous awards, including APA's Simon Bolivar Award and Lecture in Hispanic Psychiatry, and AACAP's Jean Spurlock Award and Lecture on Diversity and Culture. We're really excited to hear your talk, Dr. Pumariega. I wish we could all clap, but we're just going to have to welcome you with a lot of smiles on Zoom.
Well, thank you so much for the nice introduction. I probably should just kind of say, thank you and end at this point. But obviously, what I'd like to share with you all is some observations on cultural competence. But through observing an incredibly talented and able and creative practitioner of cultural competence in mental health. And that is my dear colleague, Booney Vance. And it was great sadness for me when we lost him back at about the time close to my departure from East Tennessee State. And I think about him often as I do my work. And I think about his legacy and in some ways how his legacy has impacted on me. And I'm going to share some of that with you all through, through observations of his actual work on the ground during one particular visit that I made with him. Again, I have fond memories of being at East Tennessee State, both as department chair and division director, and starting the Center of Excellence, and wonderful colleagues who I got to collaborate with, and carrying those fondly. So I'm very sorry I'm not there in person, but I hope I can share some warm feelings with you, and maybe at some point be able to come back and visit on a more social basis. So these are my disclosures, some of them already covered in the introduction. And these are the educational objectives. I won't dwell on them too much, but obviously I want to talk about elements of cultural competence, illustrate their application through observing the work of Dr. Vance, hypothesize how his life experiences, life philosophy may have uniquely informed him in the application of cultural competence principles, and understand how these principles can and actually are being applied in the development of effective mental health services for underserved populations, including those in the Appalachian region. So a bit more disclosure, this has been my multicultural journey. It kind of set me up for the interaction with Dr. Vance in many ways. I'm a native of Cuba, and I immigrated as a kid from point 1 to point 2, Miami, Florida. That's probably my shortest hop. Is about 120 miles direct shot from my hometown of Matanzas to Miami, and even though the cultural adaptation was huge. But from there, I stayed living in the ethnic enclave through my medical school years, and then went up north to the south. Those of you who know Miami know that Miami is technically not culturally part of the North, but landed in the Raleigh-Durham area. Then did my residency at Duke in my fellowship. From there, went on to my first round in Tennessee at Vanderbilt. And then very quickly after that was recruited to go to Texas, and the word "Go West, young man" rang back even from my fellowship supervisor. So I did a lot of work in the Houston-Galveston area, but especially along the border, the U.S.-Mexico border. So already doing work there cross-culturally with the predominantly Latino population on the border. From there, came back east to South Carolina, and then I was recruited to East Tennessee State. And obviously had my encounter and my great experiences with Dr. Vance. From then went on to the Northeast, Pennsylvania and New Jersey, before coming back to Florida, where I am right now. So, and you can see that's in many ways a geographic, but also a cultural journey. Many different cultures, many different populations, many different experiences. Dr. Vance, in terms of his background, actually came very rooted in his culture of origin, but expanded from there in almost in similar ways. He Always a loyal friend, incredibly positive, optimistic. I think those of us who remember him know that that can-do spirit that he had was incredible. He was a graduate of Science Hill. He self-identified as having a learning disability. Many people, few people are able to be that forthright. He earned football scholarships at the University of South Carolina, where I was at one time, and then at East Tennessee State. Played for the Bucks football team in the 60s, and for Science Hill in the 50s, where my daughters went to high school. And he was the main wide receiver for Steve Spurrier, who is now here in Florida. Interestingly enough, that has a whole story, which Booney actually schooled me on. He went on to get his PhD in educational psychology from Ohio State. He was director of the Child Study Center at James Madison University after that, and professor of educational psychology at East Tennessee State. And as Dr. Mosher mentioned, he did significant work in school psychology, especially interventions to address learning disabilities and the social, cognitive, and population factors associated with learning disabilities, with multiple publications and presentations. I found this searching the web a bit. So number 12 is Dr. Vance, back when he was on the Science Hill football team. I hope all you can see that. And I believe, and I don't know if family members here might be able to identify, I think number 15 on the basketball team maybe also. It looked like Booney. It didn't have a legend identifying him, but it sure looks like Booney. And this is one of his textbooks, Psychological Assessment of Children, very very widely read. And he did some interesting work that I think begins to give you a window into his thinking. Way before we ever began to think about disparities and began to think about racial ethnic issues, Dr. Vance was doing work on the issue of a very thorny issue, the issue of intelligence and racial differences in intelligence. But he was courageous enough at a time, in 1979, where there were a lot of biases about African American kids, to do work that underscored that actually in his study, he found that black males score significantly higher than whites in verbal IQ, which contradicted previous observations of poor verbal scale performance by minority subjects. In some ways, that's revolutionary. And he also did work on looking at intelligence in black children. And in this study, he performed a special analysis and WISC-R scores and internal intercorrelations. And his conclusion was that the basic ability dimensions are the same for referred African American kids as they are for referred white kids, and normals in the standardization sample for the WISC. So, in some ways, you could say he was anti-racist before that term came about. I first came into contact with Dr. Vance, and I came in as department chair, and I got a call from Jim Vaught, who sadly recently passed, and he was special assistant to President Stanton high in the administration around health sciences. And he told me about this professor in educational psychology who perhaps we might want to look at for faculty membership in psychiatry. And when I read his vita, I thought to myself, my God, this is a gift. Why are we getting this? But I think he saw the connection, the potential connection there and synergy of his coming into our department from an interdisciplinary perspective. So right away, he started making big contributions, teaching general psychiatry residents about psychoed testing, consultation for children with autism, kids with autism spectrum, intellectual disabilities, and learning disorders. As I was telling Dr. Mosher, I learned tools for the assessment of kids on the spectrum from Dr. Vance. He was already quite expert in those. He then did something incredibly creative. He was very skilled in applied behavioral analysis, which I later learned. I've been learning along the way about in my career, but he was able to apply it to working with elders with dementia. And at a time when there was rising awareness about over medication of older adults in nursing homes. So he paired up with one of our faculty members at that point, the late Dr. Kurt Kaufman, consulting to nursing homes in the East Tennessee region, and using applied behavioral analysis approaches to manage behavior non-pharmacologically and help nursing homes reduce the amount of psychotropic medications being prescribed. That was really groundbreaking. I really felt in some ways that work wasn't subjected to publication as well as it should have been, because to this day, this is not being done very effectively in many places. He had, again, a number of research publications that included work in autism, pharmacological management of various disorders, collaborating with various of us, and one study on PTSD in child survivors of the Gulf War, which I'll get to. And in some ways, Booney was the fairy godfather of the Centers of Excellence for Kids in State Custody. How is that? Well, Booney had incredible legislative relationships. He had relationships with everybody. I mean, this is a man who his emotional intelligence was through the roof, higher than just about any mountain in East Tennessee State. And he was able to connect us with legislators who then were supportive in advocating with the TennCare Bureau on the concept of the Centers of Excellence, and helped us get our startup funding. And of course, the centers continue under the East Tennessee Center under Dr. Mosier, and then the other centers at Vanderbilt and UT Memphis, and then other ones that sprung up different other parts of the state. He even went on to try to develop medical academic links between ETSU and the United Arab Emirates. But this gets me then into his, and we had a joint edited book, Clinical Assessment of Child and Adolescent Behavior. And that was incredible fun. That was my first foray into editing a book. And he was quite expert at it. This is a unique compendium. And we had a chapter there on cultural competence, which was one of the early chapters in that area. So this gets me to Booney's work in the Middle East. Now you say, wait a minute, the Middle East? Well, he has, again, this is a man with many different talents and many different streams that run through his life. Dr. Vance, shortly after he got his PhD, pursued and obtained a Fulbright fellowship under the U.S. State Department. And he did that in Cairo, Egypt, at Ain Shams University. But it's easy to go to Egypt and live in the American section or in the Western section of town and only deal with people from the United States and European countries. No, Dr. Vance went for full cultural immersion. He lived in the working class neighborhoods of Cairo. This is the areas that are poor, areas where people live day to day, don't have many modern, and back then, even now, don't have many modern amenities. A lot of, even, believe it or not, even some anti-Western ideology has grown out of those neighborhoods. But he got to know the culture, the people, the undercurrent stressors. He left a major impact there and continued to have an impact, because we had multiple visiting professors that came from Egypt to visit us at East Tennessee State and to have interactions with him. Okay. But he also frequently traveled, even before, when he was in educational psychology, before he came to psychiatry, and even before that, he frequently traveled to the region. He had an ongoing relationship with the Middle East, and was involved in developing educational programs there in educational psychology. It had an extensive professional network that he developed, and even became involved in some clinical program development. He developed training programs in educational psychology in Egypt, the Gulf states, but particularly Kuwait and the United Arab Emirates. During and I'll get to my visit to Kuwait with him, I actually got to meet many of his students. And the impressive thing, the overwhelming majority of his students were women. And this became a way that he was empowering women in that region of the world where women were not and still many times not very empowered. He went as he even had such influence and ability that he consulted to the Emirate of Oman in addressing a problem that they had. They had a number of kids with on the autism spectrum disorder. Some of them with the royal family, but some of them, you know, in the common population, and they would send their kids for care to Britain. He challenged the notion that they have to be sent away, and he proposed that they develop a residential school where the kids could be kept back in their country, receive behavioral therapy, receive educational supports. And he helped to develop this school, and in fact, he had direct dealings with the emir as he did this. And this is, believe it, not just from him telling me, this is from many of his students there and visiting scholars telling me about this work. So, after the Gulf War, there was an increased interest in children's mental health as related to the impact of the war on the population in Kuwait. And, you know, again, Booney, he went fairly regularly to the Gulf, and he asked me, would I be interested in traveling with him to Kuwait? And there was an interest in seeing what child psychiatry consultation could add in terms of some of the services there that they were being provided for kids. And he had a good relationship with the director of developmental pediatrics. It was an old colleague, Dr. Awad. And so through her, they expressed this interest in having a child psychiatrist come with him. And he asked me, would I be interested in going? Well, this is only 5 years, a little over after the Gulf War, the first Gulf War. And honestly, I had great personal trepidation about traveling to the region. Booney was fearless. He was ready to go. And I was going, oh my God, I don't know. I mean, and at that point, there was also continued provocation by Saddam Hussein. Coming out of Iraq, and occasionally they'd shoot off one of their, famous Scud missiles. I even had a lecture or a meeting I went to at the Carter Center, and I figure I was there. I even asked some of the people at the Carter Center, how do they know when it's safe to travel to some of these areas in the world? Because the Carter certainly traveled to all these hotspots, and they gave me some consultation, reassured me I was safe to go. So I said, okay, I'm willing, I'm game. My wife, sitting here with me, holding her breath while I embarked on this trip. It was literally, remember, my hop to the different culture was only 120 miles. All of a sudden, we were going halfway around the world. And I can tell you huge number of stories. Some of them are very entertaining, but not necessarily pertaining to the, to the subject. But so we went. It was a 10-day trip, but literally it was a day and some each way in terms of travel. You have to fly through London, and also through New York, or on the way back Chicago. So the main activities were 2 days of clinical consultation at the Al-Sabah Medical Center, 2 days of educational sessions with parents about kids with learning disorders, and particularly with ADHD. Some professional meetings, and the rest of the time we actually traveled the nation. The nation state is fairly small. It's the city plus the surrounding desert. We were actually official guests of the Kuwaiti government. They have an interesting ministry there. It's a ministry of hospitality, which means that they assign you a driver who also kind of keeps an eye on you to make sure you behave. But it was actually very nice to have somebody driving you around, and they pretty much took us where we wanted to go. So we again, many different, besides the consultations at the Al-Sabah Medical Center and the parent lectures, we did engage in many different activities. We visited the bazaars that were either in central city Kuwait or the surrounding desert. The desert bazaars actually was where the poor people went to buy their Pampers or to buy their toilet paper, or household goods, or the things that were less expensive. The visit to the various neighborhoods, everything from upper class 3-4 story homes, believe it or not, all the way to apartment blocks, primarily for expat workers. The majority of the workforce in Kuwait was actually from other nations. It was from everything from other nations in the Middle East, from the Philippines, India. So in some ways, it was a very multicultural setting, but clearly the Kuwaitis were in charge. We visited the National Psychiatric Hospital, and there Booney pointed out to me the British influence, that in many ways, Kuwait had been colonized by Britain, and there was a lot of still of colonial influence and even some friction around that colonization. And they at that point we were looking and seeing, well, what might they be interested in? The Brits who ran the hospital weren't very interested in much collaboration. They saw Americans as, we don't deal with them too much. We visited the Ministry of Health and deputies there to talk about mental health issues. They invited us to have some meetings, and also we visited the Center for Traumatic Stress in Kuwait, which was formed after the war. But here's the interesting thing: while we were there, Booney made a beeline when he got word of a proclamation by the Emir. The Emir of Kuwait made a proclamation that the trauma was over when we were there. It was actually a pronouncement. That meant that everybody who had suffered traumatic stress was cured. And they were, and everything was fine. So they were going to close the center. Obviously, this seemed like a bit arbitrary, and it was. The Emir wanted to move on from the trauma of the war. They had reconstructed the city as if nothing happened, except there's one building that was fairly war torn. But we made a beeline there because the people that were there had accumulated a lot of information about the atrocities that were committed by the Iraqi troops on the Kuwaiti population. Very helpful when we did the consultations at the Al-Sabah Medical Center. And also they gave us some books that they had published, all in Arabic. I couldn't read. Booney could easily, but it certainly documented many of the atrocities. We did a couple of personal consultations for families. One for the child of the assistant manager of the hotel we were staying in, who had autism spectrum. The other one, a member of the royal family, which Booney did himself because it was a sensitive matter. And I figured he probably was better equipped to deal with that matter than I was. We also had lunch at the home of the director of developmental pediatrics, and it shows you how small the world is. We're hosted for this very nice lunch, a very sumptuous lunch, and who shows up to make a brief visit but the director of child psychiatry at Menninger's. And basically, what the Menninger people were doing in the Middle East is they were looking for business, i.e., residential kids for residential treatment to be sent to the States, which is a sad thing. So a lot of treatment was being outsourced. However, all throughout all these interactions, I came away with an indelible impression, which was that Booney had complete ease interacting with all these different people at all different levels of society. Everybody from the Minister of Health to the valets of the hotel, and in between, in this very highly knowledgeable and skilled manner, almost as if he was back home in East Tennessee. But what I told him is, Booney, you're like a good old boy in East Tennessee. You're a good old boy in Kuwait. Everybody, it's this total ease of interaction, as if he was a native. So that's where I began to think, okay, how did this man do this? How is he able to accomplish this? And not only interact in a social but also in a professional manner, even in care delivery, which we did together. Actually, when we saw the kids at the Al-Sabah Medical Center, we actually had joint visits with altogether about 12, 16 kids and their families. So lesson number one, humility and respect. Booney was able to suspend value judgments about cultural beliefs and practices in such a way where he was non-judgmental and objective and respectful of other people's beliefs and values. Now, it doesn't mean that he lost the social justice perspective in terms of human rights, in terms of the rights of women. We many times commented on some, particularly on some of the issues around how women were treated in the society, and it was a very bifurcated situation. Women, in some ways, were more educated than the men, but then the men also carried on relationships outside of the formal marriages that were very obvious to us. But we kept processing that. But he really, was highly knowledgeable and understanding of the beliefs and practices of the people there. He was also, again, very aware of cultural gender role issues as we were going through this, and he really advocated. And you can see through his work with the students in Kuwait how he advocated for women in that context as this very traditional male-oriented culture. Second lesson: cultural awareness and self-awareness. He had very keen awareness of his own values and beliefs, and a certain objectivity about their origins, but he also kept them from interfering in his approach to interacting with people from different backgrounds. So he was able to put themselves in their shoes and had awareness when where their beliefs might clash with his, and hold that reaction in suspense. He never adopted a position of cultural superiority. Many people, when they travel to other nations or they deal with people of different cultures, have this sense of, well, my culture is better than yours. Never. Booney really was able to see different cultures on an equal playing field. And he was always striving to learn from those he collaborated with and served about their cultures and about how they lived their cultures. He also was very aware of the dynamics of difference, and we talk about that a lot in cultural competence work, the dynamics of difference when people come from different cultural backgrounds in a cross-cultural encounter. So, for example, he had keen awareness about how Westerns were viewed in the Gulf, and particularly through some of the history around colonization. And he was always looking to level the playing field, to not come across as the better than or the colonizer, and very sensitive to how other how other folks express their their beliefs. And at two encounters that were very illustrative. We had just visited the outdoor souk, and bazaar, and out on the desert. We were driving back, and all of a sudden, Booney tells the driver to just make a sudden stop, screech to a halt. And I go, what's going on? He says, well, hold on, I got to talk to this guy. So he jumps out, and he goes up to a perfect stranger. And this is someone who I guess you could almost say is like a Bedouin type person, okay, and sitting in the middle of the desert with some traffic swirling around him, and he was selling selling rose water, which is a sweet kind of gelatiny treat. Booney greeted him like they were long lost brothers. And the man responded in much the same way, and it was an incredible interaction. They were very intensely exchanging, a lot of conversation and also a lot of affection. And as he, wonder what this is. So he came back. Then he came back in the car. He bought some rose water and treats, and he came back in the car and says, Andy, I wanted you to see. That man over there, he's from Oman, and I did a lot of work in Oman. The Omani people are like the sweetest people on earth. They will give you their shirt off their back. This man wanted to gift me these rose water desserts. I almost had to insist on him to paying him, and so it was. He instantly recognized the man was from Oman in terms of his dress. And he had a desire to engage in the interaction, and it was a very positive interaction. And again, just to know that he had that knowledge to be able to distinguish how this man, and be able to want to demonstrate to me the kind of warmth That was just impressive. Uh, we had a different encounter when we went shopping for clothes, particularly for me. I had wanted to buy a outfit, and a true Kuwaiti male outfit with the shnasha, which is the gown, the gala, which is the headdress. And I was in a clothing store, and all of a sudden, the person who was attending to us, very attentive, all of a sudden dropped us like a hot potato and went over to the other side of the store and to attend another customer. And I go, Booney, this seems a bit rude. And he goes, wait a minute. There's a reason. He says, look at his bearing, look how he's dressed. He says, this is a royal. And he had to drop us because he has to show deference to the royal. And instantly just caught that. So of course, we cooled our heels. We were very patient till they finished that interaction. But incredible knowledge. And again, incredible cross-cultural knowledge. He knew all the incredible knowledge of the beliefs, the customs, the worldview, the emotional expression, what were acceptable practices. He sometimes adopted some of those practices in the service of engaging people, but with genuineness. I'll talk about that a little bit in a minute more. He really could serve as a cultural consultant and guide, and he did that with me. Okay, remember, I was totally unaware of this part of the world. No interaction with anybody from Kuwait, very little for anybody from the Gulf or the Middle East. And even before we got there, Booney was tutoring me on cues, on demeanor, simple things like you don't show the soles of your feet, of your shoes, because that is the highest in this respect. You kept your feet planted on the ground. You didn't cross your legs, because that would show your soles. Later, if you remember, one time when President Bush the second visited Iraq, and people and there's this man in a reporter who threw shoes at him. You can tell the significance of that one. And then he schooled me on how to interact with traditional women who were veiled. And we're talking veil is like they're veiled and they don't have burqas. Is they you can't see their eyes, but you can't see anything else. Totally covered except the eyes. And how you did not initiate interaction until they initiated. You never offered your hand to shake. You don't make direct eye contact unless it's initiated by the woman. And again, all part of the special relationship that you're to have with traditional women. Booney was close to fluent in Arabic, which is incredible. But he never boasted about it. If anything, he was very open about his gaps in fluency. He's always connecting with other people about it and asking, am I saying the right thing? He was never shy about using interpretation. But he used his linguistic skills and his knowledge of the culture to engage people. So, for example, the way that we might in let's say perhaps even in places like East Tennessee, start out with a blessing, God bless you or something like that. He was doing that with people in Arabic, and they were Muslim blessings. And it's like, wow, and people just they lit up. But it came from total genuineness. Okay, he had a deeply spiritual background, but he was able to express it through their religious context, and was able to connect with the people there. The other thing he taught me was awareness and assessment of cultural stressors and traumas, and he was able to show that. We had many open discussions about the historical stressors faced by people of the Gulf, everything from the colonial influence to the impact of the Gulf War and the geopolitics. We had a lot of open discussion about acculturation pressures. That came many times with Western influence and the impact it had on families and on family relationships with kids. had a lot of sensitivity to socioeconomic differences and disparities. And for example, the native-born Kuwaitis were much wealthier, and the expat community was they earned a living, they sent money back home, but they were definitely poorer, and there were significant disparities in differences there. And Booney was very aware of that, but also realizing that you couldn't go crusading per se. And we got to see some of these different factors at play. So he really was able to cue me to be observant about these issues. So, and that's where one of the places I became very, very keenly aware about what a concept called a culture to family distancing. When a child in the family adopts in some ways a different culture, sometimes the prevailing culture, and in this case it was Western culture, while the parents are much more traditional in their culture of origin, and the conflict it can cause. So we had cases where, when we did the consultation in the Asaba Medical Center, where we had young men that came dressed in camouflage, like the American troops. Okay. And they were very isolated into video games. They were very estranged from their parents. A lot of attention and conflict. The parents were not unschooled in terms of Western influence. They were English fluent, but the impact that the war had on, in particular, dramatic impact, played itself out with the kid identifying with literally with the military situation, and wanting to adopt a military demeanor. And then we got to see some of these factors play out, as I mentioned, in the desert souk, where poor people bought their supplies, and you can see the disparities between the poor people there and the very wealthy people in Kuwait City. We actually published a paper on this, and this is Dr. Wad, who's the head of developmental pediatrics at the Asaba Medical Center, who invited us there, and she had collected data on a large sample of kids in Kuwait that had experienced war-related traumatic events, and or who did not actually have a direct experience, and we were able to show a significant interaction effect observed by the mothers that related to the actual experience of their traumatic events and PTSD. But what we saw is that a lot of the kids, even though they did not witness warfare, and many of them even had to emigrate to other countries during the period of the war, they still were traumatized. The ones who witnessed actual shooting and death, or even aggressive behavior by the Iraqi troops, were much more traumatized. So it was also a difference of degree, and we have to see that in the clinical consultations. Booney has also an incredible commitment to advocacy and addressing barriers of care. If you're going to do work in culturally competent care, you need to advocate for the populations that you serve. And again, he was all about fostering collaboration and developing services for the underserved in that region. And he did it obviously for people in East Tennessee, but he also did it for people in the Gulf. And he really felt that there was additional quality of care that could be contributed by having interaction with us coming from the United States and some of our evidence-based approaches, while also adapting them to the cultural values and beliefs of the region. But he was always an honest broker. He was always very careful about any sense of exploitation that anybody could possibly have. He was also, again, very much of an advocate for family engagement. He's really saw the importance of engaging the whole family and when you're doing cross-cultural work, obviously the family is central to the transmission of culture, and through critical relationships, especially with kids. And he was very respectful for family dynamics. He was, really engaging in care of families and care for their loved ones with mental illness. The lectures for the parents were really that we did really were about teaching Kuwaiti moms doing psychoeducation around the ADHD, around learning disorders, how to do advocacy with the schools. Sound familiar? Similar to our situation many times in the States, but also with the value that treatment has, and including pharmacological and behavioral treatment. And he also, again, back to the focus on the cultural family distancing, he really saw that it was important to have to do work within the culture around bridging cultural divides within the family. And adaptation of practice. He was always for adapting practice in a way that was understandable and accessible to people of different culture. This is even evident when we were doing the consultations to the Asabat Medical Center, and many of the families were in some distress about their kids having lost their Islamic faith. He was very adamant about their having consultations with the imams, and in that way that they also got some spiritual counseling along with psychological and psychiatric treatment. I have this memento, which is actually the staff in the department had put these pictures together in the collage. So I have this up in my home, and it's different shots of our visit in different settings, and but I want to cue in on a couple of the pictures. This is Booney doing something that at first took me aback, but he wanted to show, again, give me another cultural lesson. We were buying some, we were looking at some souvenirs to bring home, and I saw these pillow covers that my wife might like for her couch and our couch, and then I was just going to buy them for the asking prices. Oh, you don't do that here. So he wanted to bargain. Of course, and bargaining is very cultural in the Middle East. Well, he was bargaining. The guy who was tending that little stall was a little kid. It's maybe about 10 years old, maybe 11. Okay, and I was like, but Booney, he's a little kid. You got to bargain with him. I mean, isn't that kind of like taking advantage of a kid, or not quite right? But Booney said, no, you kidding? They're very skilled. So he went back and forth, and I think the little guy was just amazed at how this Western-looking person was so skilled at doing it. But the kid held his own. Let me tell you, he really showed that there's some skills that kids learn very early in terms of negotiation, and they reached a fair price. And this is again, visiting in another stall with, as we were going around the desert souk. That was probably one of the more interesting parts of the whole visit. And this is a gentleman who was attending another gentleman was tending one of the stalls. And this was at a private house party. And one of Booney's students, her husband had one of the like 2 or 3 concessions for air conditioning in Al Kuwait. You can imagine what that business was. Incredible business. So they had a small house party in his honor. And it was great. It was again a number of these folks from the area that had gotten to know him, and there was great camaraderie there. And so it gave you a whole nother window. Now, interesting part, we were in the nation that was officially abstinent of alcohol, but there was a little drink cart that came by. The greatest lessons from Booney is that cross-cultural competence can be learned and developed. you don't necessarily have to be from the same culture and have exactly the same experience to be able to work with somebody from a different culture. He embodied that and he demonstrated that. And it's a lot of emphasis these days on one-to-one matching, okay, of professionals. You really need to have a representative number. And yes, we certainly want to strive for representative numbers of different ethnic and racial groups amongst our professional cadres. But while we get there, also, mainstream professionals, and particularly here in the United States, also have to be able to work with people different than them. And Booney is like the exemplar of this. He also had life experience and personal attributes that contributed to this. Okay, the kind of openness to experience of living and learning in cultural different settings. Okay, and navigating different cultural contexts, flexibility, creativity, and also certain personal attributes that were especially important, particularly humility. Everybody who knew Booney knew that he was incredibly humble. He never, ever presented himself in any sort of self-promoting manner, in spite of his many accomplishments. He also worked hard at developing cultural knowledge. And he also, again, integrated clinical and cultural skills. He saw the need, the importance of being able to marry those up and to use them where applicable. So this very much went along the lines of established principles for cultural competence. So not too long before that, and we went 97, in 1989, there was seminal work that was done in the Children's System of Care world and initiative around cultural competence. And there was a seminal monograph that was published on this. And the definition for the individual clinician was the state of being able of being capable of functioning effectively in the context of cultural difference. There's also parallel expectation for the organization to support that practice through practice skills, attitudes, policies, and that to enable that work. And they also emphasized particular practitioner characteristics: awareness and acceptance of difference, awareness of one's own cultural values, so you can keep them in mind and keep them from intervening unconsciously, understanding the dynamics of difference, development of between in a culturally different situation, developing cultural knowledge and the ability to adapt practice into the cultural context of the patient. Booney knew how to do all that. There, and there are many other elements that he practiced. For example, working on improving access, engagement with the youth and the family, demonstrating respect but also using a bicultural approach, understanding the cultural context of the problems they were presenting, the symptoms, the symptom expression, the level, the type of adaptation, but also their cultural strengths. Involvement of the family, psychotherapy that is practical in problem solving and addresses historical traumas and culturally related conflicts. Doesn't mean you don't address personal conflicts, but you also address in a culturally based or culturally derived conflicts in therapy. Pharmacotherapy that where you educate the consumer in such a way to demystify it rather than to kind of make it a kind of the your doctor knows everything type situation. Using natural supports, community, family supports, wherever possible, and again, including the religious and community organizations and linguistic support, i.e., knowledge of the language and idioms, using it for engagement, but also being honest about one's fluency and being able to make sure that language doesn't become a barrier to care. And some of this has been adapted into the outline for cultural formulation of the DSM, where you evaluate the cultural identity of the individual, the cultural conceptualization of illness. We saw this a lot in Kuwait, a lot of psychosomatic presentations, which we readily recognized were related to the stresses they had gone through. The psychosocial stressors and cultural features of both of vulnerability, but also resilience, what strengths does the culture bring? Cultural features the relationship between the individual and the clinician, and there obviously we have to be very aware that as Westerners, we were going to be perceived in a certain manner, and be aware, and being aware in terms of the formation of the therapeutic alliance, and then the overall cultural assessment of the patient. Since then, this work has fascinated me to no end, and I continue to do it and teach it, and I'm involved in some research. And then I was involved with a number of colleagues of mine, when I co-chaired the committee on diversity and culture of the academy. We put together the first practice parameter for culturally competent practice in any medical specialty. It is in child and adolescent psychiatry. It was published in 2013 in the Journal of the American Academy. And basically, again, the recommendations are similar to what I've talked about. Addressing barriers of care, evaluating children and families in the language they are proficient in, and the impact of carrying two languages, clinician awareness of cultural bias, the biases they bring in, awareness of culture, of the dynamics of difference, and also the different presentations of symptoms, and considering them formulation and diagnosis, the impact of culturally related trauma, the impact of acculturation and acculturation stress, particularly including families and addressing the ones that come up in families, incorporating cultural values and beliefs in treatment, providing treatment familiar within the familiar settings in the communities. Well, Booney was doing this for the Omanis. My God, he actually brought treatment within their community and repatriated the kids. Supporting parents in developing culturally appropriate behavior management skills, so they don't violate, any legal or cultural prohibitions. Using psychological and pharmacological interventions with evidence, but adapting them, and being attentive to ethnopharmacological factors, metabolic pharmacological issues. So what is the goal of all this? We talk many times about equality. In a sense, what we need to consider is that what we really should be aiming for is equity. And you need adaptations across different people and groups to reach equity, to reach the truly equivalent outcome where they can all be engaged in the game. Right. That's the end of my presentation. I'm very happy to I'm going to stop my screen share so that I can see all of you, and happy to take any questions.
Dr. Pumariega, thank you very much for this excellent presentation. And now we'll open it up to questions. If anyone has questions, you can either use the chat feature to identify yourself, or if we can take turns, people can just start asking questions.
I have a question. Can I be heard?
Yes.
Oh, hey, Andy, it's Phil Steffi. I really appreciated your talk, especially in America today. Boy, talk about cultural education. I mean, we need to be so culturally aware. I mean, we are such a broken apart people. I mean, how do we communicate with members of QAnon, for example? How do we communicate with people, Black Lives Matter? How do Appalachian people communicate with people who are on the West Coast? It seems like as a country right now, we have no cultural competency whatsoever on how to interact. And I think it's ripping our country apart. Any thoughts?
Oh, yes. And again, these were lessons from my friend Booney. he always came at it from a position of humility. He always came at it from a position of non-judgmental, and never assuming, negative intentionality. Okay, he accepted difference as difference, not as better or worse, but as difference. And I think you model that. You don't preach it necessarily, although you certainly, when you get opportunities to talk about it, you certainly can advocate, but you model it. And I think also, you focus on the issues that that people have concerns about, and legitimate concerns, but you also view them through their lens, through their perspective. And that's one thing Booney was able to do. He was able to view these issues through their perspective. Okay, he didn't go in and say, "Oh, well, this is the American solution. We're gonna, we're gonna reform the Middle East. We're gonna bring democracy. Going back to the recent war, right? We're gonna bring democracy there." Well, democracy sometimes can mean different things to different people. Some people, they have to work to a certain point to get to democracy, and it gets interpreted through different filters and lens. And we know, and we know what happened. We try to bring democracy to a certain country. We invade it, right? But you have to be humble about your enterprise. You have to be willing to help, but you also have to know your limits. And Booney knew that. Booney knew the limits and the context in which you had to do it. I always thought Booney should have worked for the State Department. I honestly did. He easily could have, been a major contributor to cross-racial, cross-cultural dialogue in this country today. And remember, he was talking about it through his science even before. So, but he did it through action. He didn't, he didn't pontificate. He did it through work on a day-to-day basis.
Andy, Tom Schock here. Good to see
Tom.
you.
Good seeing you.
So Booney was my friend too.
Yes.
And I remember lots of conversations in his office about these matters, including being present when he would take random phone calls from the sheikhs about problems they were having with their kids.
That's right.
In the moment. And one of the lessons that I learned from Booney about culture was the importance of being open-minded around what it takes to develop a therapeutic alliance. Booney was trusted by the Kuwaiti families that he worked with in a deep way that I think would be hard for many outsiders to develop. And part of how he did that was to do things that in this country we would just shake our heads at. For example, Booney told me that one of the ways he was valued was as a deliverer of contraband. He would bring Viagra and whiskey, Tennessee whiskey, to his clients.
I got to tell you the ultimate story on that one. We were flying into holy Muslim airspace, okay, on the way into Kuwait City. Yeah. And all of a sudden, Booney starts to check the duffel bag up on the, on the overhead, and he keeps checking it. And I'm going, Booney, what's up? You keep checking. He says, I got a bottle of Jack Daniels in there, and it's leaking. My heart stopped. I go, Booney, I don't know necessarily a whole lot about this region. I'm learning from you, but I think don't that shoot people or lop some part of their body off if they're caught bringing in contraband. You go, oh, don't worry, I've got it solved. So, I mean, at that point, I go, well, we're either heading straight into trouble. I'm going to see something incredible. And we landed, and I said, okay, we're going to get. I said, customs. We're coming out with handcuffs. He had somebody there from, I suspect, the government, who took us around customs. End the problem.
Right.
He knew how to work the culture too. Okay. Yeah. So he didn't do that. He didn't do that. I mean, he didn't take risks that were not mitigated. Yeah. I'm sorry.
No, he was doing, my understanding is he was doing this at the request of his clients.
Right. Exactly. And he also he sized up the risks, and he knew how to work within their system.
Right.
Right. Yeah.
I just want to make a quick comment that we've had many Booney Vance lectures since he passed away, but never one that honored Booney as much as this one today, Andy. So thank you so much for a really great job.
Well, thank you, and I hope I've done a decent job at honoring him, but also really highlighting his contributions and again and the I know we're talking largely about cultural competence and cross-cultural issues, but this is a man who overcame many personal barriers. He didn't have an easy life. He even had suffered some traumas along the way. Not too long before he died, but he died tragically. If he literally was on the table at Vanderbilt about to receive a heart. And how he developed the cardiomyopathy. He was visiting one of his daughters abroad, and I think it was something viral. So it was very tragic, but you know what? He was intrepid, and he really believed in this world and the people in it. And maybe that's the real core. It's the kind of ground level belief he had in people. Other questions? Other thoughts?
For those who can't see the chat, Dr. Musil shared
Yes.
that he so appreciates this wonderful lecture, especially how you illustrated the principles through the example of Dr. Vance.
My name is Carol Vance. Can I say something?
Oh, please, sir.
So thanks for the wonderful retrospective. I want to give you an example from his youth. Booney was held back 3 grades. Today he would have been called, he would have been in special ed. Pardon my cracking voice. But the advocacy of his mother made him go a long way. This is a man who faced adversity but had resilience. And adversity can build resilience, or it can build a victim attitude. His adversity built wonderful resilience. Thank you.
Thank you, sir. But let me also add that because he went and he weathered and he overcame such adversity, he also had empathy for people who themselves went through adversity, and a special sensitivity to them. And that's what I think that's another quality it's a little harder to find. People many times, they may sometimes some people don't go through much adversity, and they think life should be pretty smooth. And some people go through adversity, but then they think, oh, it's just me. But he could see the commonalities in adversity. And we would talk about that, and how, if we're sensitive to others, pain and adversity, we can be that much more effective. But so he always had that. And that's my incredible respect for him. And he never tired of trying. He always said, "What can I do for you?" That was literally his motto. From every time Andy, what can I do for you?
Thank you so much.
You. Thank you for sharing.
Are there any other questions or comments at this time? All right, everyone. Well, thank you very much for attending this grand rounds, and thank you to you, Dr. Pumariega, for a wonderful presentation.
Thank you, Andy.
Thank you all. Thank you all for sticking through it. And great seeing you all in East Tennessee.